work, one whole day to play. Come on, everybody, wear your roller skates today. It's Saturday, 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 it's Saturday, Saturday, it's Saturday, Saturday, it's Saturday, yeah.
Hello, friends, and welcome to episode 40 of Career Exploration Saturday. I'm your host, Ebony Tyler, and I have real conversations with real people about real jobs. So this week, my guest is Dr. Rhonda Cambridge Phillips. She's a pediatrician, and we had a wonderful conversation. Dr. Rhonda knew exactly at 10 years old that she wanted to be a doctor, and she tells us about how she executed that plan and why she chose to practice medicine in the community in which she resides. All right, let's jump right in. Good afternoon. Welcome, Dr. Rhonda Cambridge Phillips, to Career Exploration Saturday. I am so glad to have you here today.
I am so glad to be here. Thanks for having me. And, any moment I get to catch up is great. So thanks for having me. Thanks for inviting me on. And thanks to our audience who's watching right now. Thanks for spending time with us too.
All right now. Okay. So, we start all the conversations. Tell me who 16-year-old Rhonda was. Now, I know you because we were in the church youth group together. And to me, as an outsider looking on, Rhonda had it together.
Really?
You were focused. You looked like you knew where you were going in life. So when I heard that you was a doctor, I was like, not surprised.
Well, I must say, in terms of my career path and what I did want to do, I did actually have that mapped out. Now, everything else that, you navigate as a teenager and young adult, now that's a different story. But in terms of my career path, actually, I kind of always wanted to know, I always wanted to be a doctor. I always knew that that's what I wanted to be. I really don't know why, actually. I think as far as I can remember, I think probably it was about 9 or 10. That's when that idea came into my head. And pretty much everything else in terms of career path was mapped out to kind of accomplish that goal, right? So we were in the church youth group together, but we also went to the same high school, right? And so
I went to Midwood. What high school?
So did I. How could you forget?
Wait, Rhonda, you was in Midwood? Wait, what year did you graduate?
You went in a different year, but yes, I knew you went to Midwood. So did I. We probably were in a different year, right?
Yeah, I graduated in 95.
Right. I graduated in 93. So I was ahead of you, but we were in, so that's why our paths didn't cross as much in the hallways at school. But I knew that. How
did I not know that? So were you in the med-sci program? Tell me you were.
Right. So that's what I'm getting to. I was in the med-sci program and, because that was geared towards that track, the science track, and becoming a physician. And we also, at that point, you were able to take college courses at Brooklyn College in like your senior year and stuff like that. So that was really interesting. And, that's why I went to Midwood, because it was in the neighborhood. And it wasn't too far from home. My mom didn't want me like traveling too much. I had taken the, I'm having a full circle moment, right? Because my daughter just took the SAT, right? Which is the specialized high school entrance exam, right? And so I had taken that exam. And I had passed. At that point, there were only 3 specialized high schools in New York City. And now I think there's way more now. I can't even believe. We only had 3 at the time, and I had passed for Brooklyn Tech, but my mom was like, no, that area at the time, she was nervous. She was just nervous, as moms are. She was just a little nervous, and she didn't want me going that far. So Midwood was the next best thing because they had the med-sci program. And then fast forward to college, I was so on track again. I went to a program that it was at City College at the time in Manhattan. Mm-hmm. Now City College has their own medical school, but at that point, it was a program called the Sophie Davis program, mm-hmm. Sophie Davis Biomedical Education Program. And they basically took students from high school. Like if you knew you wanted to become a physician at that point, they were trying to encourage more primary care physicians. And so if you knew you wanted to become a physician, they would take you from high school, and just the whole program was geared toward that. You would have, once you passed all your courses in that program, you had a guaranteed spot in med school.
Wow.
Right. And they participated with about 5 or 6 different med schools that would take us. Right. And you didn't have to take the MCAT as well. The MCAT is that's how much I know about it. I didn't take it, but I know that it's a exam that you have to take in order to enter medical school, right? I think it's like the GRE or the LSAT.
Yeah.
Right? So the
right.
MCAT, the version for med school. But once you were in the Sophie Davis School of Biomedical Education, you didn't have to take that MCAT. Again, you started right from high school. It was a 7-year program. You did all of your college and the first 2 years of medical school in that program. And then the last 2 years of med school, because they're 4 years, the last 2 years of med school, you did at one of the participating med schools that partnered with Sophie Davis. And so you would do your last 2 years, and I matched to New York Medical College in Westchester, also in New York, right, in Valhalla, New York. And so that was my track. So in terms of career, I kind of like just had it all together in that regard, but all the other stuff, navigating what being a teenager means and just being on your own and stuff like that. Well, that was challenging. So
I have a couple of questions. So in terms of taking classes at Brooklyn College, those classes credits transferred into your
undergrad. Mm-hmm. So okay. I took,
and that was free.
Yes.
Okay.
Yeah, it was. Yeah, I took an English class. I took an English class at Brooklyn College, and so those credits transferred over. So when I went into City College, I had that requirement already taken care of. So I didn't have to pay for that course. I didn't have to take that course. I could have and I think I filled it with like an elective. I think I took piano or something like that, something like light, because everything else was, heavy on the sciences. Because the first year of that program, of course, you do the general undergrad courses, but they included some of the introductory science requirements. So,
and then getting a bachelor's degree from City College, which is a CUNY school.
Yep.
You don't have a lot of debt.
That was really good. I know that my mom was really happy about that because, college was expensive back then. It's even more expensive now. And I didn't really have that. I didn't really necessarily need to go away. So I didn't really feel like I was missing something by staying, at home.
Right.
And it was also very cheap. It was also very cheap. The CUNY tuition was nice. It was nice. And then I knew that I would be making up for that in med school. So yeah, because that wasn't free. So
Okay,
it was like,
that was a private program, a private school.
Yeah, well, yeah, it's med school. So yeah, and it wasn't a SUNY med school either. So it was private, and that's where the money that we saved, in undergrad went to. So it was nice. That was nice. It was economical. Saved a lot. Because depending on your track, sometimes that's what you have to think about. Like if you're going to be doing undergrad, but also if you have to do graduate and then postgraduate, it will add up. So any ways that you can save costs is going to be a smart idea.
Now, what's medical school like? Is it, what we see on TV, ER, Grey's Anatomy? Is it really that grueling? Tell us a little bit about medical school. ER was one of my favorite shows. I think that was in high school or high school and college. Yep.
High school and college. Yeah, it was one of my favorite shows. Now, med school, the first 2 years, like I said, you're basically in the classroom, right? And then the last 2 years, that's what they call your clinical. And, so that's where you get like on the job training, and you could be in a situation like ER as well. Yeah, that's where you could be in a situation like ER. Where now you have different tracks, right? So you go through different rotations. At one point you are in the emergency room, but then you might be on the inpatient ward. You might be in the outpatient setting, clinic, seeing patients who are just coming in for a regular visit and going home. But then when you're on the ward, those are patients that are sick enough to be admitted, and you are, learning what it means to be able to manage those kind of complicated cases. And so not only are you getting exposed to medicine in all the different layers, but also in all the different specialties as well. So what made me go into pediatrics was because of my experience when I did my pediatric rotation and taking care of children. I just love that. Surgery was something that we also rotate through. I did not like that. Can I tell you, I thought that, you have these moments in med school where you can look back now and say, oh my God, and laugh. But at the time I was like, oh my gosh, I think I'm going to fail. Because, so in your surgery rotation, you really get the experience of being on call, right? Truly on call, where you're working during the day. You might be attending lectures as well, but then you have time in the OR during the day, which is fine. It's during the day, right? But then in the nighttime, wee hours of the morning, if an emergency case comes in and you need to, accompany the attending, which is that's the head doctor, and the residents are the training doctors, and then you have the students. That's us at the time. We're not doctors yet. We're still learning. So if you're part of that team, everybody has to go in, from the attending all the way down to the students. So I did not like that part because I like to sleep. I just, so anyway, you get a page, and you have, this is back in the day of pages. I don't think anybody carries a pager anymore, but that's what it was at that time.
Right.
So your page goes off and you're sleeping, and you have to get up. And so they called for an emergency case. And I go into the OR, you have to scrub up and everything. You scrub everything, you wash your hands. Like, there's this whole process. and you put your gown on, your mask and everything. And usually when you go into the OR, the student's job is to basically hold. There are these things that are called retractors. Like, so whatever part of the body that we're working on at the time when you're doing surgery, you have to like keep everything else out the way so that the surgeon can work in that particular area and not have to like be moving different, pieces of tissue, muscles, skin, you need it out the way so the surgeon can work. So usually when I went to med school, the student's job was to do that, make sure that everything is clear, and also our second job was when we're about to close up, and at that time they did like stitches. Right. It basically looked like thread, right? That's what it's like. But it's actually thread that you can sew the area closed, but it matches with the body, right? So the student's job was also to cut those. It can't be too long, it can't be too short, right? So those two jobs, those were our two jobs, retracting and cutting the sutures. I was just bad at it. I was just bad. And I think it was because I was too tired. Okay. Then again, I was also short. Like, I'm not a tall person. So usually I had to stand on a stool, of course, because I'm like, I have to be above the patient, like above. And I can't I'm not tall enough to just be on my feet. So I'd be on a little stool and standing. And I kid you not, this is when I thought I was going to fail. So we're retracting. And I fell asleep. I dozed off in the middle of and I'm just telling, anybody that knows me, I'm very practical and I tell the truth. I don't, so I fell asleep and I was like, I don't know how long I was asleep. It was probably like just a few seconds. Yeah. Like if you're tired and you just doze off and then you wake up and you're like, wait, how much time did I miss? What happened? But nobody realized. But after that, I was like, okay, this is not for me. You see, this one is not for me. Because I'm like holding, and then I'm like, I wake up and I'm like, wait, I don't know what happened. I lost some time because the last thing I remember, he was working over there. Now he's on this side. And I don't remember what is going on. I mean, I was still holding things and everything was still in its place. But I was like, oh, Lord, this is not for me. Surgery is not for me.
So those rotations are so important for you to learn what's your jam,
what you could see yourself doing and what you cannot see yourself doing.
Right.
So at that point, I was like, okay, surgery, I cannot see myself doing that, and you also get to see, how to manage certain cases. You learn how to talk to patients. You develop your bedside manner. And then you really just get a chance to put what you've been studying on in those 2 years when we were in the classroom and studying just with our textbooks. Yeah. Right? You now get to put that into something that's real time. And so you're like, oh, yeah, we were learning about this artery and that artery. And for example, you get to see like the actual heart in motion as it's pumping. Yeah. And like you see all these things in the book and you're like, oh, the aorta, the mitral valve, all the different things. And it was just really exciting to me. That's why, when I talk about medicine, it's really exciting. But I know it's not for everybody because sometimes I'm talking and people are like, ew, that's too.
How did you decide to become a pediatrician?
Well, I'll tell you, when I did my pediatric rotation, the first patient that I had right? So as medical students, you also carry patients. They give you a caseload. This may be like, it's not much. It's 2 or 3 patients, and you're working alongside your resident, which is the training doctor, and there are different levels, right? So you have like an intern, which is your first year. You just came out of medical school, and this is your first year of being a doctor, but you're still training. That's an intern or a first year resident. Then you have a second year and third year, and it goes on in terms of the experience and how many years away from medical school you're on the job training. So when you're a medical student, they give you a panel of patients to follow and take care of and take ownership, right? And again, you're not by yourself. You're working along with your residents, the whole team. You're attending, the nurses, everybody that's part of that medical team. You are part of that team as well. But you are supposed to take ownership of the patient and kind of think, okay, what would I do if this were my actual patient, right? So the first patient I had, and again, this is Westchester, right? So just think about the demographic,
Okay.
I don't need to say much more, but
Right. Westchester.
The graphic is different.
Yeah, it's not the city.
So yeah, it's not the city. But my first patient was an 11-year-old girl, Caribbean American. She was actually born in Grenada and was transferred from another hospital. I can't remember which one, but it was like a city hospital in New York, and was transferred to Westchester Medical Center in order to, because they had services that she required. She actually had sickle cell disease, and she had fever that no one could figure out the source of the fever. We couldn't, did all these tests in the other hospital for about 2 weeks, couldn't figure it out. So she was transferred to Westchester. So number one, she looked like me. Okay, I could identify because my family's from the Caribbean too. She looked like me. She could have been a family member. So I already felt a connection to her, right? And I felt like, okay, this is someone that I really need to take care of. Not that I wouldn't have taken care of. I mean, you take care of all your patients, but you have a connection because I could identify with that family. Right. I could identify with, her upbringing and things like that. And we were able to help her. And I felt like it made a difference, me being on that team, because I was able to explain some of the cultural nuances that maybe the rest of the team didn't know because they don't come from that background. Right. So when they were saying certain things or gathering information from the family, it would be like, oh, well, what does this mean? And then I was able to kind of, I don't want to use the word translate because, of course, we're all speaking English, but I was able to help the rest of the team understand, where they're coming from. And then I was able to help that family understand where the medical team was coming from. So it seemed like I was almost a mediator in a sense. And it made a whole difference. Say that again.
Cultural competency, right?
Right. And it made a whole difference in the care of that patient.
Wow.
Everyone was on the same page. Nothing fell through the cracks. The family felt, acknowledged. They felt like they understood what was going on. They were part of the process. And also the medical team, the rest of the medical team felt like, okay, we now understand, how to reach this patient. And so, that made me just feel like I really was in a position of service and to help. And it made me feel, well, how many other families could be like this? And, what would have happened if they didn't have someone on the team that could understand them in a way that, they probably would not have been understood. And we see that a lot. I mean, even to this day, we see that a lot. It's one of the reasons why I chose to still stay in this community and work, and why I still live in this community as well, because I want to be let's say on the grassroots level, so to speak. I want to have my ear to the ground and really understand what's going on, because it's the only way that we can make a difference. And when it comes to healthcare, we know that there's a lot of disparities when it comes to healthcare, in terms of bias and systematic racism and just, cultural differences that because we don't understand, it really affects the type of care that someone receives. And I felt like, okay, in addition to understanding all the basics of medicine, how disease comes about, all the different medications, all that stuff that we learned in medical school, it's important to understand that part. And that's something that they're only now teaching in medical school now. It just started because of everything that's been happening in the climate now. But I see them being really intentional about putting courses around health disparities and bias and identifying biases that you might have that affects the kind of care you give, and affects the type of care, how the patient perceives that care being given. And so before, like, we would have like a workshop here and there, but now it's like part of the curriculum, which is really nice to see.
I mean, it's really nice to see, but it's like that should have been happening, right? But I want to go back to what you said. You are a doctor in the community in which you live in, which is Brooklyn.
Yep.
And you're still in Flatbush.
Yes, and I was intentional about that.
Yeah.
Now, sometimes, I'm not going to lie, I told you I'm very practical. Sometimes I look at myself like, certain things happen in the community and you're like, really? We're still doing this? Why did I decide to? And then you're like, okay, no. You're going to be part of the solution. You're either going to be part of the problem or you're going to be part of the solution. And so, it was intentional for me to do that, because I don't know, I have a lot of other colleagues that I came up with that, they're not practicing in the same area that they grew up in. And that's a personal choice. I'm not throwing shade here, there, or anywhere. Sometimes, depending on the job that you take or the career path that you're going, you might have specialized in something that you needed to get training elsewhere and you just happen to stay there, all that stuff. But I was just really intentional about wanting to stay in the community, live in the community, work in the community again, so I could have my ear to the ground and be like, no, this is what's happening.
And then I also remember, I think it was last year, I'm not sure if it was Humans of New York, but it was a social media post about a young woman who became a doctor, and she said her pediatrician was Dr. Cambridge. Yeah. And now she's a doctor. And I was like,
did you see that?
That Rhonda?
Yes, that was me. I mean, I didn't know either. It was, people were showing it to me and I was like, what? They were like, oh, you're famous. I came to work one day and they were like, oh, the famous Dr. Cambridge Phillips. And I was like, what did they? I was just like, whatever. They on some, I don't know what they talking about. I'm gonna just do what I do, And then several people were like, no, this is real. You did not see this? And I was like, no, I didn't see it. And you know what? It just goes to show, because that touched me in a way that I don't think anything else could have, because I really didn't think I made that kind of impression on her at all, in no way, shape, or form. I mean, yes, I felt like I gave her good care. Of course, again, she looked like me, and I'm like, she could have been me. I could have been her. You know, she could be my daughter. She could be a family member. So, you know, and I tend to treat all my patients like that, whether they, you know, whether I identify with them or not, because when it comes to health, it's such a vulnerable state that you're in, and we have to be cognizant of that. You know, how we approach our patients and how we explain things to them and how we give the care. But I remember her, you know, now I can say Dr. Satanya Douglas is her name, right? Yeah. And I remember as she was struggling, and I would just be like, no, come on, you could deal with that. That's not a big deal. No, don't stop. Don't give up. And I would just say things like that and like tell her, listen, if I could do it, so could you. But I never realized that I was the only and first Black physician that she came in contact with ever in her life. This was one of the things that she said. And I was shocked by that. I was like, really?
Yeah. Like, do you know how hard it was for me to find a Black doctors? Like, my doctors are Black. My kids' doctors are not. You know, I haven't found one for the, you know, a pediatrician that's Black. But it's so important to have a doctor who understands your culture and your cultural background so that they can understand, am I being a little dramatic right now? Or is it a real concern? And speaking the same language as you is very, very important. It's really hard to find Black doctors. Now, how do we get more Dr. Rhondas out here? How do we get more?
Well, you know what? I think there's not too many of us, you know, because I was looking at the statistics the other day, that in terms of Black female physicians in the United States, we're only 2%. When I saw that number, I was like, 2%? I mean, because I'm thinking to myself, I know I have, you know, quite a few colleagues that are Black, but I didn't know it was so low. I was like, 2%? And when it comes to Black physicians in general in the United States, we're probably about a third, like, you know, 30% or so, 30 to 35%. But when I saw that statistic of Black female physicians, I said, oh, this is not good. I don't know if I should feel honored because I'm liking the 2% or like upset because like this is crazy. Like, how could this be? And I think it comes to, and there must be some kind of resource out there like this, some kind of resource where we're all in a database or something like that. I don't know if something like that exists. And if it doesn't exist, we need to make something like that. And if it does, we just need to make sure that our people know that this exists. And then it also brings to mind of how do we get our young people to be more interested in the sciences? Because we not only need physicians, but we need researchers. I mean, all of the stuff that's with the vaccine and the COVID vaccine, I know everybody's hearing about how our community is perceiving the vaccine. Everybody's scared and nervous and, you know, and we're really trying to jump on that narrative and really trying to get people the right information because we're the ones that are affected more by the COVID, unfortunately.
Take this opportunity to tell us what we need to know about the vaccine.
Well, first I want to say that I took the vaccine. I think I took it back in December. I finished my first few doses, and you know, I'm saying this as a joke. I'm not walking backwards. I don't feel that you know, my mind is controlled by anything yet. I mean, who knows what's going to happen? But right now, as it stood, I had no side effects. I did well, And most of the cases that you're seeing of people who had side effects, they probably had something underlying going on, that happened at the time. But I really think that getting the vaccine is a personal decision. I really do believe that. And I am not here to, tell anyone to get the vaccine or not to get it. I think what we need to do is operate from the standpoint of being knowledgeable about it and having as much truthful information. That information should not come from a post on social media, a spliced video. That's not information. Google is also not information. I think when we want to get the information, you should go to a trusted healthcare provider, sit down with that person and have an honest conversation, but be willing to have an open mind. Yes, we know about what happened in history. Yes, we know about the ways that our group has been oppressed and, experimented on. Yes, we know that. But while we have to know our past, we can't be stuck in the past. And I think a lot of us are being stuck, and rightfully so. I understand the fears. I understand. But we also have to have the right information. So I would say, go to your healthcare provider and sit down with that provider and have a conversation about whether or not you should consider getting vaccinated in your situation. What risk factors do you have? Is it age? Do you have underlying health conditions? Are you taking care of someone who does have an underlying health condition or is an elderly person? Are you, these are the things that you have to really discuss, right? Yes, we can have all of that history behind it and discussing that, but now you have to make a decision for you and your family. And the truth of the matter is that we know that not everybody's going to get vaccinated. We understand that. But what we're trying to achieve is that herd immunity, right? Where 60 to 70% at least of the population gets vaccinated, and that will protect everyone else. So I say to people, listen, if you don't want to get the vaccine and you feel that you made a judgment call based on proper information, more power to you. I respect that, but don't try to convince somebody else not to get it because you don't know their situation. And actually, if other people get it, it protects you because, again, that is contributing to that herd immunity.
Right.
So let people be. Just let people be. Because, I tell people, oh, I got the vaccine. They're like, what? How could you? And I'm like, no, I think I was being responsible doing that. And I feel like you're not getting it, so you should be happy that I got it. I took one for the team.
That's right.
I got,
I also believe that more people who get the vaccine need to tell people that they got the vaccine and to share the story, because people's personal story has helped change.
It resonates more.
Yeah.
Than a video that you saw of somebody you don't know, somebody fainting after they got the vaccine, not understanding that they have a condition where they faint after all vaccines. It's not the COVID. It's just, if it was the measles vaccine, they would, So I'm just like, no, just you look at that and then you just, get the right information. And even though you get the vaccine, because we have not reached the herd immunity yet, because we're still fighting with people to get it, that's why you have to still wear your mask. Right? We haven't reached the herd immunity. And remember, the vaccine does several things. One, it's gonna, definitely contribute to the fact that if you get the COVID, it's not gonna take you out. Like, you're not gonna get so sick. But it doesn't mean that you can't get COVID-19 at all. You could get it and just be asymptomatic. So you still have to do your part and protect others. That's why, because I hear this thing saying, well, why do I have to, if I got the vaccine, I still have to wear a mask. I still have to social distance. Yes, we still have to do that right now because we haven't achieved that herd immunity yet. We just haven't, and it's going to take some time. And, I know a lot of people are waiting to see what's going to happen. And now, it's funny because the people who are rushing for the vaccine, it's not us. It's not us. So, I say, and by the time we're ready to get it, maybe I'm just hoping that, because right now there's a shortage because of the weather in our area in New York. There was delays in shipment. I know people heard the mayor, well, you may or may not have heard, but the mayor did a mini press conference about it a couple of days ago, that we were going to expect those delays because of the weather that we've been having, not only in our area, but all over. It's been really bad. And, my prayers go out to those residents in places like Texas where they're really having a hard time, so I couldn't let us go without saying that, because I know they're having a hard time. And, again, that too is also based around ethnicity and the bias that we're seeing. Some people are doing well and some people are not, but it's really nice to see in that state people helping one another regardless of what's going on. They're really helping. So there's hope. That's nice to see.
So I want to talk a little bit about what you are doing now, eradicating nutritional suicide, one person at a time. Tell us what that is, and you've been doing that for 20 years, so it seems like it's a passion.
Yeah, you know what? I'm a creature of habits, so I think I just, hook onto something and just try to find new and innovative ways to get information out and really try to motivate people in our community to just take action and just focus on small steps, small things that we can each do. Because when you take those small steps and put those action steps together, it becomes really huge steps that really can make a difference in your overall health and wellness. Mm-hmm. And so if we're healthy, that's something that we're going to pass on to our families, mm-hmm. right? Mm-hmm. Because we're not living in a bubble, right? So, and we tend to, and a lot of the health issues that we see, there are some things that definitely are genetic, right? Like you have a gene in your family for, a certain medical condition, and there's a chance that it will be expressed in you or some people in your family. But I think of genes like if you have just a loaded gun on a table and it's just sitting there and it's not doing anything, it's just there. It takes someone to pick up that gun and pull the trigger, right? To make it really harmful. And that's what I think happens with our environment, right? So you can have a gene for something, but it doesn't mean it's necessarily going to be expressed. It takes something in the environment to trigger it off. And a lot of times we're not going to know at the time. So when we're preemptive, or when we focus on prevention and little things like getting an extra sleep, getting an extra hour of sleep a night, starting with that. If you're not exercising right now, just start exercising 10 minutes, twice a week. That's if you go with where you are. It doesn't have to be all or nothing. If you decide, okay, you want to change your diet, you don't have to cut everything out. You don't have to be a vegan to be healthy. You really don't. is not necessary. You can start with just saying, I'm gonna start my day with a glass of lukewarm lemon water, because you know that's alkalizing to the body. It sets up your digestion for the day. It revs up your metabolism. Just start with that. And that's something simple that anybody can do. When you're preparing dinner for the kids, get the kids involved. Have them, plan a healthy menu, or have them involved, because, if they're involved with the meal planning and preparation, they're probably going to eat it. No matter how bad it tastes or how healthy it is, they're going to eat it because they made it.
Yep.
I see that a lot with my kids. I'm like, this is not, but they eat it. And I'm like, oh, because they made it. They take ownership of it. So a lot of, what I do is focused on lifestyle changes, and particularly starting with our nutrition, because again, in our neighborhoods, it's difficult sometimes to eat healthy, because, the things that are brought into our neighborhood is not always the healthiest. And sometimes we end up having to travel outside of our neighborhood to get fresher produce, better variety. And not everybody can travel outside all the time based on the time constraints.
Right.
But there are still things that we can do to make a difference. So a lot of what I do when it comes to eradicating nutritional suicide, one person at a time, is just saying, okay, well, what can you do in your little corner right now as we speak to make sure that you're healthier, tomorrow as opposed to today? And it doesn't have to, it doesn't have to take all this planning. You don't necessarily have to join a gym or have all this equipment. You don't have to buy dumbbells. For example, if you don't have dumbbells, take a couple of bottles of water and use that as dumbbells. We all have, water around the house, and it carries a certain weight. So it's like just helping my clients find, innovative ways to stay healthy. And it's not necessarily about your weight or how you look. It's also how you feel too. And it really makes a difference in cutting down on all of the preventative health issues that we, see in our community. The high blood pressure, the diabetes, the cancer is a big one, stroke. Incidentally, February is National Heart Health Month. So I've been talking a lot, about that, and just finding ways to just keep your heart healthy, add in more vegetables, have a salad with your dinner, couple times a week to get those veggies in, so that's the premise of what I do. I want to make it easier for all of us to stay healthy despite the busy lives that we lead, because I know it's hard for me. Yeah. It's really hard. I'm not going to sit here and say it's easy, because it's not. And during this COVID has done a lot of negative, but also some positive. And one of the things I'm working on is my weight, because, just being more sedentary and not going out as much. And I have to really be intentional about finding ways to exercise and get more movement, and stuff.
So how can we learn more about your work, this work? Do you have a website?
I'm on various social media platforms. I'm on Facebook, I'm on Instagram, Twitter, LinkedIn, but also I have a website. It's just my name, my full name, Dr. Rhonda Cambridge Phillips.com. And on there you can learn a little bit more about me. and my philosophy towards health and wellness. And also, there's some free services that you can sign up for, some wellness programs, some quick wellness programs that you can jump in. I have a couple of podcasts on there. I recently wrote a book on cancer, so you can actually see that on the website. So there's lots of information. And if you want to reach out to me, you could just send me a message there and we could connect that way. Yeah.
Now, is there a final question? Is there any advice that you would give a young person who's thinking about becoming a doctor? Or maybe how can we encourage young people who are interested in the sciences to become a doctor, to go into research?
Well, I think one of the things that really helped me was volunteering in an actual hospital. I know I did that during high school, and I volunteered in one of the clinics. It was actually at Downstate Medical Center. I was a volunteer there, and I worked in just, in the helping out in the front staff, registering patients, getting them ready to see the doctor, but kind of learning how it works. And then also, if you're into the sciences and you're not really sure that you want to be a doctor, but you just want to, maybe you're interested in research. And a lot of times you might have a science project that you need to do for high school or even junior high. And, you can also volunteer in the lab as well. A lot of the research labs are taking on volunteer students as well. So I think the best thing to do would just be to volunteer in whatever field. This not only goes for if you want to be a doctor in the sciences, whatever field you want to be involved in, because it's nice to say, oh, I want to be that, I want to do this, but can you really see yourself doing it every day and loving it? Because the kind of career you want, this is my young people now, right? The kind of career you want is something that you would do even if you didn't get paid, right? And the getting paid part is just like icing on the cake, the cherry on top. But you would do that, you live it, you breathe it, you think about it, you dream it, that's what you want. Something that you're passionate about, but turn it into something that people will pay you well to do. That's how you, cha-ching, that's how you make it. So I would say volunteer. Like if you want to be a veterinarian, right? Go to a pet shop and see if you could, and sometimes you have to take the initiative. Just go in and say, listen, I'm thinking about being a vet. Do you think, do you have any opportunities that I could come in maybe one day a week for a couple of hours and just see what you do? There might be some paperwork you have to fill out, some other people you need to talk to, some medical forms you have to get filled out to clear and everything to volunteer there. But that's what I would recommend if you're whatever. So I would say if you're interested in the sciences or medicine, just find a place that you can volunteer. I've had many students that volunteer with us and then end up, a couple of students, I could think, end up becoming physicians, and they come back and say, Dr. Cambridge, I did it, and I'm like, yes. And I always tell them, I'm like, I hope we get to work together someday. And it happened to me, but this was with a nursing student. She was my patient. Last story I'm going to tell. She was my patient for from when she was 13 to 21. And she always would come back past 21 and ask me to do little stuff for her, sign a paper, get this refill. And I would help out because she didn't find a doctor yet. One day she came down, I went to the waiting room to call a patient, and I see her and I start going off. I'm like, no, I can't keep doing this. You're almost, you have to be 25 now. I know you're 25. How come you didn't find a doctor yet? I can't sign another paper. I just assumed that's what she was there for. And do you know, she coolly said to me, she was like, yes, Dr. Cambridge, I know. But I'm working with you today. I'm your nurse today. I was like, what? She's like, yes, I'm working with you. I'm like, no, you work here? She's like, yes, I'm a nurse. I finished nursing school. I'm like, oh, so you're going to be giving my shots today? She's like, yes. I'm like, so you're giving my meds today? She's like, yes, Dr. Cambridge. I'm like, and I just gave her a big hug in the middle of the, I'm like, I'm so proud of you. And she started laughing, and even to this day, like, she floats around the hospital now. She doesn't only work with me, but every time she comes down to work with me, she tells everybody about that story, and we just have a big laugh. So it happens.
Because representation matters.
Yeah, it does. It was really nice.
Dr. Rhonda, this was amazing. Thank you so much.
It was amazing. It was nice catching up. And like I said, hats off to you for all of the work that you're doing in our community, the initiatives and helping our young people, because I know that makes a difference. It makes a difference. And like I said, anything you need, any way that I can help, do not hesitate to reach out to me. You have my permission. And I had fun. I hope you guys did too. I had fun.
Thank you so much, Dr. Rhonda. So some takeaways are, if you are interested in science, medicine, health, you should volunteer. Volunteer at a hospital, at a research lab. Also, when you get into medical school, soak up what you're learning on your rotations. This is where you're going to learn how to manage cases, and this is where you're going to develop your bedside manner. 2, cultural competency is essential in providing high quality care to patients. It builds connection and community. And 3, take small steps, small consistent steps to make a difference in improving your health. Get the kids involved in meal planning and have a salad with every meal. Thank you so much, Dr. Cambridge, and welcome to the Liberated Success family. Thank you for watching and listening all the way to the end. If you find our work impactful, informative, important, show us some love with the donation. Donation links are in my bio on IG, Twitter, and YouTube. It's the first comment on Facebook. And if you're listening on the podcast, you can make a donation via listener support. Don't forget to subscribe to the YouTube channel, subscribe to the podcast, follow us on IG, Facebook, and Twitter. All right, wear your mask, wash your hands, physically distance. Get that vaccine if you think that that's going to help you. I got my second appointment this week. I'm excited to be fully vaccinated so that I could get back in these streets. All right, all Black Lives Matter, and I will see you next week. Bye.
One whole